Welcome to One-on-One. I'm Greg Bassey, your host from the Salisbury Independent newspaper. It's a big day here at PAC 14. They're all big. We have the man who's in the spotlight in Salisbury right now, Stephen Leonard from Peninsula Regional Health System. Welcome, sir.
Good morning. I must say, you have good timing.
Yes, exactly. We had you to come in here to talk about your big merger, and we'll get to that. But please tell us.
Seems so small right now.
It does. The reality of the world has hit, and please, reassure us what's going on. What do you guys have planned for this coronavirus stuff?
Yeah, no, it's definitely, thanks for having me, first of all.
You.
And, we'll get to that other stuff. But obviously, this is the topic of the day, and probably for the next few weeks. And lots of preparation going on. We haven't seen any active confirmed cases here on the shore. But at the same time, obviously, when it's not so much a matter of if. That's, our healthcare, our medical leaders are saying it's more like when. And at this point, lots of preparation going on for that. I must say that for several years now, healthcare has really been laying especially us, we've been laying a good foundation for this type of need. If you remember Ebola,
right?
When there was some scare with Ebola. We are one of the designated centers that has the capability to perform an intake with the proper protections for our staff, with the proper infrastructure from a room perspective to handle even Ebola, which has a much higher mortality than this particular virus. So that preparation over the last several years has, I would say, has equipped us as well as we can, as well as any other leading organization, to eventually meet the need of patients who come to us. So today we're spending a lot of time on communication, because I think there's obviously lots of fear out there, and really just trying to get the correct information out there, because at the end of the day, this is not Ebola.
Right.
The medical leaders, the physicians out there are really working hard to describe what this is. And yes, it's more serious than the flu. It's easier to transmit than the flu. And for certain patient populations, definitely something that can be just as dangerous as the flu. But it's not Ebola. And I think that's what we're trying to communicate with people out there. Really those things that each and every year we should be doing during the flu season. So how do we make sure we're washing our hands, limiting contact? If you're sick, stay home. The vast majority of people who get coronavirus are not going to have severe symptoms. And that's really what we're trying to focus on now, while we fine-tune our system, at the hospital, so that when patients do present and they are under investigation, in other words, they present with some symptoms that may be aligned with this, and we do screening questions. We've been doing screening questions for years. Where have you traveled? Who have you been in contact with? That we can appropriately manage that, protect our staff, because that's extremely important to us, while also making sure that people get the care they need.
Right. Now, we have a high senior population here, probably more than most communities. And people with underlying conditions are the ones who might be more at threat. Does that make it more problematic for our area?
I think it's something we've talked about, because there's the age factor, and then there's also the coexisting conditions, folks who have perhaps heart disease, diabetes, cancer, people who are immunocompromised, people who might not be able to even normally handle a strong flu case.
Right.
So it's definitely something we've talked about. It's something we've as a part of our health system, we have nursing homes in our health system. Now with the McCready joining the family, we have one down in Chrisfield, and then obviously the Genesis facility over on Route 50. So we have been spending time making sure that those facilities are adequately prepared, and really, quite frankly, just limiting contact with the outside at this point in time. One of the most significant cases or scenarios was out in Washington State, with a nursing home in Washington State. And that actually really opened up everyone's eyes, as that's a vulnerable population.
Right.
And in that type of environment, you really want to make sure that you're limiting outside contact, you're practicing good hand hygiene, and all of those other best practices.
But there's this, perhaps a need coming up for lots of hospital beds. How does that work out?
Yeah, so, healthcare has been evolving. So obviously part of our goal from a system perspective is to have care closer to home. Ideally, you're not needing a hospital, you're not needing an emergency department, you're really working with your primary care doctor to stay healthy and well. So that's been our goal for the last, probably since 2010, we've been evolving more that way. Yet at the same time, during a situation where you have a needed surge, you have to be prepared for these types of things. So I think that's where probably the U.S. healthcare system has somewhat of an advantage, because we do have the infrastructure. We've been taking care of sick people for us 120 5 years
Right.
almost. So I think if a surge is coming and is needed, those are things that we're probably well equipped to handle. Obviously, there could be implications with other services. For instance, a fair amount of the work we do every day at 100 East Carroll Street is elective, right? You come in for surgeries that might be elective, and they can be scheduled well in advance. They don't necessarily need to happen on that day or week. So some of those types of things, if there is a needed surge in really acute, sick, ill care, then it could impact, the ability to do elective cases. Not the end of the world. They get rescheduled while we work through whatever it might be from a volume perspective, creating challenges. But we're nowhere near that at this point in time. And it's been a busy flu season.
Right. I mean,
this year.
people are ill with the flu right now.
I tell you right now, I would tell you, at least here and locally, you have a better chance of catching the flu than you do this
Right.
virus. And so we've seen that, absolutely. And there's been days where we've had 300 plus patients in the building. And, so that's kind of the normal winter season for us. So that should be, one of the positive things is, we're getting into March and April, and, the normal, that subsides somewhat before the summertime.
Right.
And so that'll be helpful as well. And we'll see what it has an effect, at least on this virus as well.
And you all have the great flu vaccination program where you give the shots out at the Shorebird
Yeah,
Stadium. It's
you never
amazing how
know.
many
Next
people
year
go
we
through
might
there.
be doing another type of vaccination program,
Right.
but it's definitely something. Yeah, and like I said, I think this is one of those scenarios this year where hopefully it opens people's eyes to really what should be good practice every year. In terms of how do we just minimize transmission. It's kind of an interesting social experiment we have going on here, and there's probably going to be lots of papers on it in terms of our ability to influence something like this. But really, we should be doing it every year. If there's a vaccine out there, you should be getting it. So as well as practicing those things. So yeah, the flu vaccine, the drive-through flu clinic, we'll have that next year, just like we have this year, and we'll be there to meet the needs.
All right, it's on TV a lot. People hear what the process is, but tell me locally what the process should be. If I think that I might have a problem, what do I do?
Yeah, so we've been trying to get that information out there more. So you can go to our website, peninsula.org, and on the top there's a banner for COVID-19, and it opens up a page with many frequently asked questions, like what should I do if I'm sick, and so forth. So there's a few things that we're encouraging people. First, if you're not having significant symptoms like difficulty breathing and distress, the first thing you do is you actually don't want to come to the ER. You want to actually call your doctor, call the health department, and those numbers are on our website, and really get guidance as to where to go and what to do. Hopefully we can start doing more of this triage outside of the ER. We want to reserve the ER for the people who are truly in distress. Okay, if you're just curious if I've got it, that's probably not the place to go. You want to call the health department, and you want to call your primary care physician, because they can ask you questions to help determine the best path. Much of the decision making now is really ruling out other things. They might do a flu test. We do different respiratory panels, and when we've had patients who present with what could be this coronavirus, but at the same time, they've all been ruled out for other stuff. So that's really where you'd want to start.
You guys also released a new visitation policy at the hospital at PMC in Salisbury.
Yeah, we were ahead of the governor by a few hours yesterday. So we put ours out there just ahead of that. Then he actually announced basically a sweeping change across the board. So we are limiting the hours of visitation, as well as limiting the number of people who can visit with a patient. That's probably good information to get out there. We love having visitors, but this isn't the time unless it's necessary. So we are limiting it to one visitor per patient at a time. If you're in labor and delivery, you can have two. What we're also encouraging folks is the hours have been limited, okay, as well as we really would prefer people don't wait in our waiting rooms, because that's an area of congregation. So we'd like to hand off to be outside in the parking lot, coordinated in some ways, such as I'll visit from this time to this time, and then you tell your family member I'll go to this time and this time, but really having people not wait in our waiting rooms during this time period.
All right, let's talk about what we came here to talk about.
Okay.
Your acquisitions, mergers.
Yeah.
You guys have done some dramatic things in the last year.
Yeah, it's been an interesting, busy year. So for about 18 months, we've been Nanticoke first has gone through a process where they identified a need, probably several years ago actually, to eventually partner with someone. So they went through an RFP process essentially, and started out with about 14 different organizations, and that got whittled down. And We were up against an extremely large academic-like organization, and we ended up getting selected. And that merger was completed, and the affiliation took place January 1st. That was very exciting for us. And then just recently, March 1st, Sunday, a couple weeks ago, McCready joined the family. They had been going through essentially an understanding that they needed to merge with someone as well. So it's been quite a bit of activity. It's something that when I came into the role a couple of years ago, it was on the list to evolve and increase scale. Quite honestly, I didn't think it was going to happen so soon and all at once, with two organizations essentially at the same time. So, but I think it's important. It's important from a delivery perspective. Both of those are important for different reasons, quite frankly. They're very different scenarios for us. Healthcare in the future is about some degree of scale. Smaller hospitals tend to have a more difficult time maintaining services when certain costs are increasing, whether it be information technology costs, costs of recruiting physicians to the area, overhead costs, you name it, costs are increasing. And if you're a small organization, it's harder to maintain and sustain yourself in those types of environments. So we've been seeing it for probably 20 years in the industry where more and more of these activities are happening. So it's really not a surprise, that they're happening here locally as well. We've always been a little bit larger. So we've been somewhat insulated from that decision-making process. We have no plans to go and merge with someone larger, but at the same time, the idea of regionally coming together to serve a common population as well as achieve some of those savings was important to us in both cases for different reasons.
Your primary goal is to make sure that we're all healthy, especially now you'll have a corridor that you're responsible from all the way from basically Greenwood down to Accomack, Virginia.
Yeah, so let me pause on the profit status. So technically speaking, yes, we are not for profit from an IRS perspective, but at the end of the day, there's an adage in healthcare: no margin, no mission.
Right.
So you do have to make some money. We're more like supermarkets in healthcare. It's that 1-2% type of margin, maybe 3% if things are going well, especially in the state of Maryland because we're regulated. But there does have to be some profit because we take those profits and we reinvest it in capital to make sure we've got the infrastructure necessary. But yeah, the region is definitely increasing. We've always as a hospital, we've been responsible for locally, you could say our primary service area has been always Worcester, Wycomico, and Somerset County, going back to the 50s when we got our hospital license, even though we've been in existence since 1897. But we've always received complex referrals from Sussex, Dorchester, even Accomack County, and now even with Nanticoke coming in, Caroline County. So definitely the population is growing, but that's an important part of the equation going forward, because healthcare in the future is about taking care of a population and a certain number of people. In order to do that well, you need to have a population of a certain size to minimize the variability with outliers. If I'm taking care of a small population, if I have an outlier, in other words, a case that's extraordinarily expensive, that has a larger effect. But if you're taking care of a larger population, you can actually reduce your variability, and it's kind of like insurance companies. You have to have a certain amount in your population to minimize the variability from a risk perspective. So regionally, it's getting larger as well as the population, and that's what really positions healthcare in the future. Is you kind of have to have both. Delaware, Delaware was interesting for us because now we're more, we have a larger footprint in Delaware. Most people didn't realize even before the Nanticoke merger, about 24% of our revenue came from Delaware. So that's about $100 million was coming from Delaware. And what most people probably don't realize is it's actually the complex stuff. We would get a lot of referrals for our open heart program, our neurosurgery program. The things that we do are complicated, that Nanticoke can't do, that most other hospitals in the region can't do. We would actually get those referrals from Delaware. What was concerning to us, and Nanticoke had a lot of good choices, and if they had chosen another facility, that money and those patients might not have stayed coming here.
Right.
So that's one of the reasons it was also competitive for us, because we understood that had Nanticoke chosen a different partner, chances are those complex patients would have gone somewhere else. And what does that do? Well, if you have all of these highly qualified physicians and infrastructure here, and you just lost 25% of your revenue, then you might not be in a position to provide some of those services in the future. So that was very strategically important, and not to mention the growth rate in Sussex County is obviously enormous.
Right.
McCready was a different picture for us. McCready, Somerset's either the second poorest or the poorest county in the state. Completely a mission-driven conversation. We
Right.
want to be there to support Somerset County. McCready has a great tradition in providing that support. Obviously, Crisfield has changed over the years, yet at the same time, we saw an opportunity to kind of ensure that we've got sustainable services in, what is the likely poorest county in the country, if not the second. So two very different conversations, one very strategic in scale and the other one pure mission. And quite frankly, that's kind of it was a great mix, even though it was obviously for our team a lot of work over the last year, especially kind of getting these things up and going.
Right. A lot of pride down there in Crisfield that they had the hospital.
It's great. Yeah.
But at the same time, in terms of gossip, it's been that the storyline has been that they've been begging Peninsula Regional to buy them for years, to take them under for years. That sort of helped them out down there.
Yeah. So can I say that was probably inaccurate gossip? We've always been ready to be there, and I've got a file relatively thick on the different times that McCready has evaluated their future. And I don't think anyone from McCready would, it's not like any other organization where you really want to hold on to tradition and do it yourself. And we totally respect that, and over the years they tried to make it work, hard working, the honor associated about keeping the entity going independently, that probably is more of the conversation. We're just really just trying to make it work, and ultimately getting to the point where their size didn't allow that, in that same manner, because we did change the way they look effective March 1st. So that's probably more of an accurate, was they really wanted to make it work themselves, but they did get to the point where they said we need a partner.
Right. So. And the plan down there is to build a new facility with a more modern way of doing medicine. Yeah.
So we transitioned them to be what's called a freestanding medical center in the state of Maryland. So there's an emergency department there that's open 24 hours a day, as well as primary care physicians, some imaging equipment, a lab, rehab, and what else? Behavioral health services.
Right.
So that's those. So they no longer do inpatient services, and they no longer do surgery. So that's what they look like now. If they need that level of service, the patients come up to Salisbury, where we have the infrastructure. So they're on the current McCready campus, which is probably one of the most beautiful places I've ever been.
Beautiful waterfront property. It seems like it could have better uses, perhaps.
It is absolutely gorgeous. And let me tell you something, if I ever need, at some point when I need rehab or nursing home services, I will be in that nursing home, because if I have to spend some time where, I want that view.
Yeah.
So part of the challenge, though, is we did evaluate renovating the existing building for this new service, and there's obviously the building from the 1920s, which is the really old part of the hospital, and then the existing hospital was built in 1982 or 1984. Renovating was actually more expensive than actually building a newer building. Plus, the challenge is it is on it does flood down there.
Right.
And so we actually, in order to ensure that we've got something longer term in the future, we brought it inland. So we did identify property, and it's on 413, just as you approach Crisfield, where we will be building. It's about a 25,000 square foot building. If you've been to Ocean Pines, it's about the size, our campus in Ocean Pines, it's about the size of the cancer center, that type of building.
That's a beautiful facility there in Ocean Pines.
Yeah, no, that's good. So we're building that type of building down there. It's purpose built just for these functions. And again, we're able to make sure Crisfield and lower Somerset County have the services they need in a structured way. Because absent this, that population would be even more challenged. So it takes a while to build down there.
Right.
We have to, there's quite a bit of permitting. It's more complicated given the coastal nature and environmental. So we have to. I think we're probably not breaking ground until probably a year from now. By the time we prepare the site, go through the permitting process, and then it's the typical 18 months probably to build it. So we're a little way out. In the meantime, we're going to provide great service in the existing building, and work to get them healthy and well and sustainable.
And the Nanticoke Memorial, it's an amazing kind of a venerable institution, certainly in Seaford.
Yeah.
And the patients there really love that hospital. It gets great reviews in terms of the doctors, and people love their hospital there in Seaford.
Yeah, no, they definitely do. And, I think like anything, there's always some hesitation about coming into a larger system like this. But they've got lots of great tradition, and started back after World War II. We took some time to study up on their history and really the community coming together to build. They're a hospital, and we want to be respectful to that. But they do really well. Their patient experience has typically been higher than ours. Ours has been coming up in the last few years, but they have a strong track record of great patient experience and being a very safe organization. They don't do necessarily the same complexity we do, obviously, but at the same time, for the stuff they do a great job. So we're excited to bring them in, and our teams have begun integration. We've had their kind of restructure the leadership team, look at responsibility for departments across multiple facilities, all the normal stuff that happens when both of us go from being a one hospital system to a multiple hospital system. But it's been great to work with them. And Penny Short is the president up there. Steve Rose retired.
Right.
And Penny Short took over, and she's got a great history with the organization. She's a nurse. She was the chief operating officer, and she's just great with the organization and the community. So I enjoy supporting her as she leads that hospital.
One of the things people complain about to me, and I think it's because they don't understand. They go, well, PRMC, they've gobbled up my doctor again. My doctor's going to have to go to work for the hospital now.
Yeah.
But my experience when that has happened, my quality of care has actually improved at the specialist. Explain how that works and what your motive is there.
Yeah. So. If you remember, I was talking a few minutes ago about from a hospital perspective, it's tough being in business sometimes. The margins are very small, and getting by is challenging. I will tell you, I always tell people, if you think a hospital has it difficult, try being a small independent physician and making the equation work. Only over the years, their revenue has gone down per visit, and much like hospitals, their costs have gone up, and they have to buy electronic healthcare records. They have to invest in infrastructure, staff costs, you name it. So economically speaking, more and more providers are becoming part of systems because they have trouble making the equation work. So that's kind of a norm out there. So it used to be a day and age where hospitals would come to a community and hang a shingle. People who graduate from residency and fellowship these days, we also have a new generational impact. They actually just want to work for a system. They don't necessarily have that entrepreneurial type drive where I want to be my own boss and run my own practice.
Right. They don't want their own small business. They want to work for a bigger enterprise.
More of the business, unfortunately, for doctors who are independent is the business side of it, as opposed to really what they went to all that training in school for, which was taking care of people. So what we try to do is handle the not so fun stuff while giving them more time to really focus in on taking care of the patients. So so that's a phenomenon that's been happening. Now, there's still definitely some specialties out there where they even have enough size and scale to make the equation work, and where the economics are different, and perhaps they're getting more reimbursement for their specialty than other specialties do, because it is different depending upon the specialty.
An example of that would be Peninsula Orthopedics.
Yes, great.
You go there, it's like going to an airport. It's a huge place.
Yeah, and they're great partners of ours. They obviously, they're essential to us providing services at the hospital, but they're a good it's a great example. Thank you. Of an organization, long history and tradition. If you look back, I think it's plus 50 years, where they have achieved a certain size and scale where they can make the equation work. And happy for them, totally. But for the most part, almost all the other providers that are necessary for a hospital haven't. So more and more people become employed. So when Nanticoke came into the family, and with our employed providers, I think we are over 250 employed providers at this point. So what that does is we ensure that the providers are in the community. The other advantage is we're all on one medical record. So when you go from one place to another, you're on the same medical record.
That website you have for patients is amazing.
Yeah, epic. Yeah.
It's funny. I go through and I read my stuff, my report, and it was so funny. I read one of the doctors had written in the notes, said someone needs to discuss Mr. Bassett's weight with him, and I was like, ooh, gosh, I guess I do have a problem. And the next time I went to the doctor, my doctor said, by the way, we need to talk about your weight. And I was like, I knew that was coming.
There's definitely a point where those are hard conversations, because, I asked my doctor's awesome, Dr. Nateson, and I said, when do you have to start having those hard conversations with me? He says, when you turn 50, by the way, my conversations are going to change. I'm like, oh, great, I have to look forward to that. But yeah, those are hard conversations. Yeah. But more importantly, though, giving patients access to their records
to know what's being said about you.
Huge. Yeah, exactly. So And you're going to see more of that as we continue to do upgrades with Epic. We're getting ready to do one next month where there's going to be even more transparency so we can get you involved, get us involved in our care, because it can't just be a one way. We have to have that ownership of this. It's really my record. How do I become part of the care process? Because we've got work to do. It's hard work. I mean, no one wants to do the things that aren't fun, and but we have to do the best we can to give people the information and get it out there. So that's one of the other advantages of the enterprise, when it comes to having providers on one team. But it's really the economics and the fact that it just doesn't happen anymore where people just are independent.
One of my favorite adages is that, people think they know, but they don't know. So what's the biggest misconception that you have to shoot down where people think they know about what you do at the hospital, what your job is, what your role is, what your life is like? What do you want to tell people that they don't know?
Oh, what they don't know. I think people assume, that, I run an institution, and, in some ways, yeah, that might be true. Yeah, technically I'm the president and CEO, but I benefit from an amazing team, and quite frankly, that's who I'm in awe of. People think my job is hard, and I put in a lot of hours, and I have all this pressure. Some of that's definitely true. I'm not going to deny it, but at the same time, there's a larger team there, quite frankly, that's amazing. When I think about what we're doing for coronavirus or what have you, whatever it is that month or that year, it's not me. It's really the team that gets it done. I think about the nurses on the front line taking care of these patients. They're the ones doing the hard work. It's the nurses, the techs, the doctors, the patient registration folks. They're the ones that, quite frankly, when all of us are going through this process in society with something like coronavirus, they're on the front lines. And, thankfully, it makes my job a heck of a lot easier
Right.
knowing that we've got such an amazing team there.
Tell us the website again and where I can look for coronavirus
So
news.
www.peninsula.org. We just put quite a bit of information out this week. If you just go to peninsula.org, and on the top on the banner there's a COVID-19 link, an alert COVID-19. That will take you to a website specifically that talks about frequently asked questions. What should I do if I'm sick? The numbers to call, including the health department and 211. What we're doing to prepare, in case you're curious. So that's good information out there for folks, and definitely look at folks look at us and look at some others who are delivering accurate information, and try not to get caught up too much in the hysteria. Just be diligent and do what we would do from a normal viral perspective.
He's Steve Leonard. He's the president and CEO of the Peninsula Regional Health System, and we're thrilled that he had time to be here with us today. Thanks so much for being here.
No, thanks for having us.
I'm Greg Bassett from the Salisbury Independent Newspaper. Another edition of 101 right here on PAC 14.
First Shore Federal is proud to support PAC 14 and one-on-one. We'd encourage every business to support PAC 14 and pick a program and support it, and let's make a difference.